Hi, it's Erin and welcome back to my channel. So in my last video, I briefly mentioned having a condition called EDS, or Ehlers-Danlos syndrome. And I have EDS type 3, which in most cases is a pretty benign condition. You get chronic pain. I think some people get chronic fatigue. I know I do. And a lot of people just have issues with subluxation and issues with their joints because the main issue with EDS 3 is the connective tissue. Something is wrong with our collagen production, collagen 4 specifically, that kind of messes with all the tendons and ligaments, and some people get some nerve issues. Like I said, generally outside of that, it's pretty benign. Most people that I have seen with EDS, I've seen about 4 total with my condition, can get by with like a cane sometimes. But there are some cases where the patient gets very severe complications, and that's about 8% of cases. I'm one of the 8%, so I don't just get some subluxation and some issues. My EDS in my case is suspected to have taken my hearing, and I have a condition called POTS, which can be very common with EDS. POTS is postural orthostatic tachycardia syndrome. So instead of the normal heartbeat is like 70 beats per minute, roughly, more or less, depending on your height, your age, your weight, your general healthiness. That's normal. My normal heart rate is 100 plus beats per minute. It's very fast. It comes with chronic fatigue. It's so much more than just being tired. I'm always fatigued. And sometimes napping doesn't help. I do nap a lot because I just don't have energy. And I need the nap to replenish some of the energy. I faint a lot when I stand up. So postural refers to your posture. Orthostatic is an upright position, so if you're standing in an upright position posture-wise, or you're sitting upright. Tachycardia refers to the heart, it refers to my fast heartbeat, it refers to my blood and my cardiovascular system, including all your veins and arteries. And then syndrome just refers to it being a condition. So when I stand up, I have to sit back down a good portion of the time. I get very dizzy, very lightheaded, and I faint a lot. And sometimes, despite my best efforts, I will faint while I've already been standing for quite a while. It's definitely a condition that you watch. And I'm going to say not everybody with EDS 3 has this condition, but it is very, very common. And I am oversimplifying the condition. And they say, my doctors, they say I have the POTS because of the severity of my EDS. I'm one of those people, if I'm not very careful, I can just bend all the way down. And I don't. I try not to, because usually when I do, I end up dislocating something. Usually, very often, most all of the time. I do have 2 joints I don't dislocate anymore. I physically cannot, and those are honestly my favorite joints because I do end up having a little bit less pain. So that's the start. I also have an autoimmune disease, which I'm not getting into because we're my team of doctors is torn between maybe three because of the aggressiveness, and there are three conditions that can come with EDS type 3 if you're in my area of severity. So I'm not fully diagnosed, is what it is. The main issue they have with it is I do have growths caused by my body just growing like tumors. They're very benign, they don't do anything on my lymph nodes. And my immune system then proceeds to attack those lymph nodes. I will say, well, it doesn't just attack the lymph nodes. I'll be honest, it attacks everything. My immune system attacks my entire body and itself. It attacks itself. So when I say I have no immune system, it's very mild exaggeration. I have a very poor immune system. I have a very weak immune system. I'm one of those people that anti-vaxxers are like, if you're vaccinated, you won't get sick. Well, I can't even get the flu. I'm vaccinated because I had to be, and we didn't know I was sick. But now that we do, I can't even get the flu shot. So that's that. And I am trying to oversimplify and give you a very broad spectrum. Not a broad spectrum, I'm trying to give you my spectrum. I'm giving you basically the norm. I do take a lot of medication. I do a lot of things for my health. And I do my best. But because I have these conditions, I do have a lot of physical pain all of the time, everywhere. I say that, and people are probably like, oh, it's not everywhere. It's everywhere. And some days it's like a 2 or 3. It's not anything to like, ooh, this hurts. I'm in so much pain. 2 or 3, it's like, okay, I'm sore. It's no big deal. And some days it's, I can't get out of bed. There are days I cannot get out of bed. With these conditions, you also get something called chronic fatigue. So some days I'm fatigued. I have no energy despite having done very, very little. And the reason I get the fatigue is my body is trying to get better. It's trying to heal. It's trying to be the same as, to be a normal body, to not have injuries, to not have illness, and to get rid of what's making me sick, to get rid of the invaders in my body, my autoimmune disease. So I say about 80% of my energy, 80, 85 at most, maybe as low as like 70% of my energy. So quite a good portion of my energy, 70 to 85%, goes to getting better. It goes to my body trying to heal. Which then leaves me with very, and so I have to kind of manage. Now, how did I get diagnosed? That's a very odd question that sometimes I get because people are like, oh, how do you get diagnosed with that? Some people with EDS don't get diagnosed till later in life, and it's when something goes horribly wrong. So I mentioned having had surgery, the 2 joints I can't dislocate. And one was they had to repair the ligament because I just destroyed it by skinning my knee on asphalt. And I removed all of the skin. It was very nasty. And I had to have surgery to fix the ligaments that had been exposed because of skinning my knee. I skidded a bit on asphalt. And so I have that scar, and so they had to replace the ligaments. They had to stitch them together, and they don't move around much. They are normal ligaments, pretty much. This shoulder, however, yay, everybody gets to see it. You don't see my scars through the lighting, they're actually very, very faint. This shoulder is what led to me getting diagnosed, what led to the process of where I'm at today, and still within that process of figuring out everything about my body. It hasn't been 2 years. I had my surgery April of last year, so it's been over a year actually, but it's getting closer to 2 years. So, as you can see, maybe not. I have scars. What happened was I dislocated my shoulder horrendously. It was the worst dislocation. And I was in the military. So I was in the Navy. My first class at the time watched it happen. And you could probably see the shock on my face when it dislocated. I was thrown a box. I tried to catch it. I failed. It was a very heavy box. It jerked my whole shoulder out of its socket. And sometimes with EDS, I knew things just pulled out a little bit and went back in. But this didn't. It completely removed from socket. And my first class told me to go to the urgent care center at the Naval Hospital, which is in my area. One of them. There are plenty for many bases, but the one in my area. And I went, and the first thing I told the front desk was I dislocated my shoulder. By the way, if you're in a medical field and somebody says they dislocated the shoulder, they usually don't believe you, first off. Second off, they're going to get mad at you for diagnosing yourself. Or at least the hospital did for me. Until they saw my shoulder, and it was very obviously dislocated. You could tell it was dislocated by just looking at me through a uniform. So me saying that, they actually paid attention. So I did that. I went to the UCC, got pulled into the triage, which then pulls you into the back where they have like a trauma center, which is where they deal with injuries like broken bones or dislocations or allergic reactions. And they get you seen by a doctor ASAP. It's also where all the nurses and corpsmen can see you. A corpsman is a nurse in the Navy, a enlisted nurse is the best way to explain that. All the nurses can see you so they can monitor you with no issues. Now, if you just go in for like wound care to the urgent care center, which you have to go to on the weekends, they will just put you in like a private room. This was one of those things they put you in the trauma center for. Trying to explain the way the Navy works in this situation. And the doctor walked up to me. He started to get on to me for self-diagnosing. And then he looked at my arm. I had taken my blouse off because they had to get my vitals. Looked at my arm and said, "Nope, that's a dislocation." And I got sent straight to X-ray. This is where it led to me getting surgery. The corpsman who was doing my X-ray, it was an enlisted member. He was not very kind to my shoulder. And he did end up popping it back into place or reducing it on accident during my X-ray. Because I couldn't move my arm, so he had to do it for me. That was painful, the reduction. I may have sworn quite a bit. I may have gotten yelled at by a mother who was nearby me. There are very thin walls in the X-ray rooms, and she was next door, and she heard me and came to yell at me. After a couple weeks, it was clear my shoulder wasn't healing. It couldn't stay back in the socket. So they did an MRI and saw my labrum had been pulled off my glenoid, which your labrum actually holds your shoulder in the socket, and the glenoid's the cartilage head to keep it gliding smoothly and moving the way it's supposed to. And mine had been torn off. I could no longer keep my shoulder in the socket. And some people, if they do a labral tear, they could still move their arm. Mine had torn to the point where it stayed dislocated no matter what. And so April of 2017, I had surgery. So this is a timeline between January to April that they had to get me prepped for surgery. And I had to do physical therapy and everything to get ready for surgery. Well, my surgeon, who kept looking at the MRI over the time because he said it looked weird, the day of surgery, he came to me and he said, "I think you have EDS, but I'm not going to be sure until I get in there." What's EDS? Ehlers-Danlos syndrome. The only reason I'm not sure is we can't properly diagnose you because you're getting prepped for surgery. However, I can see the markers when I see your ligament. I'll know what I'm looking for. So I came out of surgery, and I came with my post-op packet and everything, and the person who had come with me to get me home got packet and paperwork for what EDS was, and that was my diagnosis. And so when I went back a couple days later I had to get my stitches redone. One of them had popped. He told me, he was like, "Oh, I don't know if you saw, you were diagnosed with Ehlers-Danlos syndrome, so now you have to go to these doctors to get tested for these conditions." And so through that process, I got re-diagnosed. And because I got diagnosed with a disability like I did, I couldn't serve anymore. I had to get out. However, I had just had surgery. So they wanted to give me some time to heal and regain use of my arm. So that was my third year in the military. I ended up finishing my fourth year just trying to heal, which was the last year of my contract, but I was now trying to heal and get used to a new diagnosis. And during that time, I ended up losing my religion. And I had finished my internship in my job now. So that's how I got diagnosed, how I got to where I'm at today. If y'all have any questions, feel free to ask in the comment section. If you like this video, give it a thumbs up. If you want, subscribe, and I hope you have a fantastic day.